Hello everyone, my name is Jennifer Naller and I will be discussing case study 49, which is major depressive disorder. So major depressive disorder is also known as MDD. MDD is characterized by persistent feeling of sadness or lack of interest in outside stimulus. Signs and symptoms of MDD include negative thinking, agitation, restlessness, inability to focus. Individuals have a tendency to lash out at loved ones. They tend to be irritable. They withdraw from others and withdraw from activities that they previously enjoyed doing. There could be an increase or decrease in sleep. They could be very tired, lethargic. They also could be expressing suicidal thoughts and be having weight loss, weight gain, change in appetite, things like that. Some treatment for MDD disorder includes medications, psychotherapy, and ECT is also used on occasion, though it's not very frequent. There's also some other somatic therapies as well. Treatment needs to be tailored to the individual. They can vary, the symptoms vary in each patient, so it's very important for the provider and the therapist to work together to kind of help get the best treatment for these individuals. So the patient here in case study 49 is Mr. HB. He's a 75-year-old male. He is widowed and has been remarried. He has no relevant past medical history, no known family history of psychiatric disorders, denies current medications, denies allergies, and his physical exam is unremarkable. He has been expressing how deeply losing his wife has been affecting him. He stated that she was the love of his life and she can never be replaced. As I mentioned before, he has remarried and has contemplated divorce, as his new wife has made him feel isolated from his son, his first wife's family, and his neighbors. The patient is a devout Catholic and feels he would be condemned if he divorced his current wife. The patient also mentions he is forgetful and sleeps poorly at night. So his chief complaints include feeling down in the dumps for years. He feels lost. He feels like he has lost everyone who has meant anything to him, most notably his first wife, who he was with for 19 years. He believes that life is not worth living anymore. So this is just some current research. This one is about psychosocial treatments for major depressive disorder. This goes into behavioral therapy, cognitive therapy, and interpersonal therapy. These pharmacological treatments have been found to have superior effectiveness than either of those individually. So this article went into great detail about combining the two treatments, both medication and therapy. We have another research article here which just goes into detail about social functioning in a major depressive disorder. It goes into depression. It's associated with social risk factors such as social impairments and poor social functioning. In particular, it describes biopsychosocial interplay regarding impaired affiliation and attachment with individuals and family, and impaired social perception. They feel as if others are not interested in being with them, or they're not interested in their relationships, and things of that nature. Okay, question 1. Identify 3 major risk factors that have possibly contributed to depression in this patient. So, the loss of his first wife. He was married to his first wife for 27 years prior to her passing away after she had had a stroke. He describes her as the love of his life and she can never be replaced. 2, we have isolation from his neighbors, his son, and his first wife's family. He stated his current wife made him put up a privacy fence, and that caused discord between him and his neighbors, who he was very close with. She has stopped him from seeing his son's wife, and his grandson from visiting. And his wife, insisted he no longer visit his previous wife's father-in-law or sister-in-law. Lastly, he has unhappiness with his current wife. He mentioned he married too soon after his first wife's death, 2 years after she passed, and has contemplated divorce, but since he is a devout Catholic, he feels for doing so. Does this patient satisfy all the diagnostic criteria for major depressive disorder? So if we click this link, or we can just open it. Just give me 1 second. Okay, here we go. I found this handy little chart here. So we can click off to see what symptoms that he does have. So depressed mood. I would say Mr. HB does have depressed mood. He does emphasize feeling sad, feeling lonely, hopeless. So we can check that off. He has stated that he has lost some interest in certain activities and, tends to isolate himself a little bit, or more so his current wife has encouraged that. He has not had weight loss or weight gain, so we'll leave that one unchecked. He did mention he has not been sleeping well, so we can check off that. He has not expressed, he has expressed psychomotor retardation. He mentions how he can sometimes feel confused, things like that. He mentions fatigue. He does mention feeling worthless, and he does feel guilt for marrying his current wife. He does mention having decreased concentration, and he has expressed thoughts of death or suicide. He does not have a plan, but he has discussed wanting to be with his wife, his former wife. Here are some additional criteria that must be met in order to be diagnosed with major depressive disorder. Symptoms include significant stress or impairment in social, occupational, or other important areas. Yes. The episode is not contributed to substance use or another medical condition. From what we see in his chart, we have no other medical conditions, and he does have some alcohol use, but not enough to be significant. This episode is not better explained by psychoaffective disorder or schizophrenia. He's not been diagnosed with that, and he's not exhibiting symptoms of that either. And he also has no history of manic or hypomanic episodes. So if we go by this, as you can see below, it says it's positive. So he does indeed have major depressive disorder according to this chart. So now we can go back to the PowerPoint. Okay. Question 3. Should hospitalization be considered for this patient, or should outpatient treatment be adequate? The patient has expressed feelings of not wanting to live anymore and wanting to be with his deceased wife. He does not have a plan. There's also mention in the chart that there is not a firearm in the home, or that there is a firearm in the home. With the information that's been provided, I would feel removal of the gun from the home, in addition to a contract for safety with the patient. With those two things in place, he would be appropriate for outpatient therapy. If the patient were unable to contract for safety or was refusing to give up the firearm, I would recommend inpatient therapy. Also, if he were to express a plan for how he would kill himself, then I would, of course, also say inpatient hospitalization, followed by outpatient therapy would be appropriate for him. Okay. Question 4. Identify a minimum of 12 clinical manifestations that are consistent with major depression in this patient. So as it was mentioned before, the patient does exhibit quite a few signs and symptoms of major depression, feelings of sadness, tearfulness, hopelessness, loss of interest or pleasure, sleep disturbances, tiredness and lack of energy. He's anxious, agitated. He's slower of thinking. He's having trouble concentrating. He has feelings of worthlessness and guilt, trouble thinking and concentrating. He has frequent recurrent thoughts of death, not so much suicide, but death in general, and unexplained physical problems such as difficulty sleeping and things like that. Lastly, is bipolar depression a reasonable alternative diagnosis in this patient? I feel it is not. The patient does not exhibit the highs and lows or manic behavior, which is very typical in bipolar disorder. He just seems to be down, and there's really no high or manic behavior in this patient. Question 12. Provide a reasonable justification for the determination of GGT in this patient. Normal GGT is 0 to 30. This patient's is at 38. A possible cause for this could be the patient's alcohol use. He did admit to drinking 1 to 2 beers several times a week, so that could cause the minor increase in this level, or the patient could be minimizing his alcohol use, which would explain the higher GGT. Lastly, we have some of the references that were used. I hope you enjoyed my presentation. Thank you.